Bell's Palsy, A Complete Guide. Author, PhD in Pathology, Specialist in Neuromuscular Diseases. 1. Introduction. Bell's palsy, also known as idiopathic peripheral facial paralysis, is a sudden and usually temporary neurological condition that causes weakness or paralysis of the muscles on one side of the face. It is one of the most common causes of facial paralysis worldwide, affecting approximately 15 to 30 people per 100,000 annually. Despite its unusual name, it is generally a benign and self-limiting condition, meaning that most patients recover completely with or without treatment. 2. What causes Bell's palsy? Bell's palsy is caused by inflammation of the facial nerve, cranial nerve 7, which controls facial muscle movement. When this nerve is inflamed, it swells within a narrow bony canal in the skull, compressing its fibers and impairing its function. Although the exact cause is not yet fully understood, it is believed to be related to a latent viral infection, specifically herpes simplex virus type 1, HSV1, the same virus that causes cold sores. Other possible viruses: herpes zoster, Epstein-Barr virus, cytomegalovirus, influenza, among others. These viruses are believed to remain dormant in the nerve ganglia and can be reactivated by stress, immunosuppression, or other conditions, leading to nerve inflammation. 3. Anatomy and pathophysiology. The facial nerve, cranial nerve 7, is responsible for several functions: facial muscle movements, eye closure, control of the lacrimal and salivary glands, taste perception in the anterior 2/3 of the tongue. When inflammation occurs in this nerve, the nerve fibers lose normal electrical conduction, leading to paralysis of the muscles it innervates. Consequences of facial nerve injury: facial weakness or paralysis on the affected side, difficulty closing the eye, facial asymmetry, drooping mouth, difficulty smiling or frowning. 4. Symptoms of Bell's palsy. Symptoms appear quickly, often within hours, and include symptom description: unilateral facial weakness, inability to move half of the face, lip ptosis, crooked mouth with runny saliva, inability to close the eye can cause dry eyes and risk of corneal ulcers, excessive tearing or decreased tear production. Due to damage to the lacrimal glands, taste changes, loss of taste on the front of the tongue, hypersensitivity to sound, hyperacusis, due to paralysis of the stapedius muscle, retroauricular, behind the ear, pain. May precede symptoms, motors. 5. Diagnosis. Diagnosis is clinical, based on the patient's history and physical and neurological examination. Features that help confirm: sudden onset of facial paralysis, absence of other neurological changes, complete or incomplete paralysis of all muscles on one side of the face, including the forehead. Differential diagnosis. It is important to rule out other causes of facial paralysis, such as stroke CVA, usually spares the forehead muscles, facial nerve tumors, Lyme disease Ramsay-Hunt syndrome associated with herpes zoster, traumatic paralysis, additional tests in doubtful cases, magnetic resonance imaging, MRI, to rule out tumors or intracranial lesions. Electromyography, ENMG, assesses facial nerve function. Serological tests if specific infections, such as Lyme disease, are suspected. 6. Treatment of Bell's palsy is based on 3 pillars. A. Corticosteroid therapy, corticosteroids. High-dose prednisone or prednisolone for 7 to 10 days. Reduces nerve inflammation and significantly improves recovery rates. B. Antivirals, controversial. Some doctors add acyclovir or valacyclovir, especially if a viral infection is suspected. There is still no complete consensus, but it may be helpful in more severe cases. C. Eye care lubrication with artificial tears and ophthalmic ointments. Use of an eye patch at night to protect the cornea. In severe cases, temporary closure of the eyelid, tarsorrhaphy, may be necessary. 7. Prognosis and recovery. About 70% complete, 15% partial, and 15% unresolved.